Why you don't like Coke and Pepsi and a lot of sugars? Because then your intestine, once it receives the food, then it has to send the signal to the pancreas, because that is the duty of the intestines. So it sends signals to the pancreas. It sends high amplitude signals if you take a lot of carbohydrate sugars, and that's why the insulin is kind of released quickly from the pancreas. Now comes the question of diabetes. At times it goes up, and then you see in the morning it is 6.5 to 7. So that's again, we need to understand how MGB works for diabetes. Now your sensor has changed. The food is entering at a different point, which is about 6 feet down. That is a new point which receives the food. Earlier the food was touching here at the first point of the intestine. Now it's touching at 6 feet down. That is the new point, new sensor. It is going to behave in a different way.
But just sorry to interrupt, but ਮੈਨੂੰ ऐसे कि जिदा मिठी लस्सी पीती, the sugar should be going down with the way it's been explained. But I feel it goes up. Then later on maybe it's coming down, but straight away shoot हो रही है.
That's how you can know about that. If you take some sugar, check your blood levels at 30 minutes, 60 minutes, 90 minutes, 120 minutes. Because once sugar will go up, then the body will control it. Then pancreas will supply more insulin. That's why your average sugar is now actually going down, which was like 8 earlier. Now it's around 6.5 to 7.
That's right. But I'm still taking my tablet of that sugar.
Okay, which it's actually it's not required. I have seen many patients who are coming from abroad when they see their medical doctors. So generally there is a tendency, because that medical doctor is used to giving you these tablets from last 6-7 years. So we think that why do withdraw it all of a sudden? But you'll see, even if you don't take the tablet, it will not make much of difference on the average sugar. So our target is that your average sugar should be around 6. Our target is not to avoid tablets or not to avoid insulin. This is not a cure of diabetes. We should never think like that. Earlier you were a diabetic, now also you are a diabetic. We should not take it that way, that it cures the diabetes. It's a very good control on diabetes, because your sensor has changed, and the way your pancreas behaves to sugars, to the control of sugar, that is totally different, and that's why your average sugar goes down. And but we can say it's like a very good control. If this is tablet, this is insulin, here is your mini gastric bypass, because of the change in that food delivery point. What happens down the line, 5, 7 years, 10 years down the line? There are patients, I have seen 4 to 5% of the patients, again the sugar starts coming back. But 95% of the patients, they are good. Their HbA1c is still around 5.5 to 6. So what's happening to those patients who are getting diabetes back? They are gaining weight, most of them. That's what I have seen. So now if you start gaining weight over a period of time, then this diabetes can again come back. So you must keep in your mind
that they will reach to that target where they started.
Not that easy. Because MGB is a strong surgery, you have a bypass and restriction is going to stay. Not that easy. But if you are totally addicted to sugars, you are, during the day, all the times you are taking Coke, Pepsi, and then other sugars, chocolates, candies throughout the day, then you can come back to the original point. And I have seen some patients who take like 1 bottle of alcohol every day. That's like, putting in too much of calories. If you are slightly disciplined.
Over there it's only when you come over here, then you see these jalebis and gulab jamun, then you say you are here, might as well try, But over there it's
but there is a lot of junk food available, in the Western countries and even in Australia. So these burgers and pizza, all these things, there's a lot of cheese in that.
No, but yeah,
Yeah.
I'm not into that much. I
Okay.
think so. So yeah,
But
pretty
after
okay with that.
MGB, you can take anything and everything, but you should not be addicted to something. Like throughout the day, you should not be taking the junk or the sugars.
ठीक.
So just behave in a moderate way.
But coffee
Your result-
and tea is okay.
Tea,
Without
coffee,
sugar,
2-3 times a day,
is okay.
even with sugar, no problem.
ठीक.
10 times a day, not good. But even if you are taking 10 times a day, then your weight will start going up. Then you will notice that your weight is going up. Then if you stop for 2 months, again it will go down. So I would say MGB is a very strong tool which is always out for you,
ठीक.
and it will start working when you want it to work. It will stop working. It will work as much as you want it to. That's how you should use it. Like a new car, you drive it safely, it will keep on working well. Even after 10 years, it will be like a new one. That's how you should take this tool. Very good tool to control diabetes, very good tool to control your weight. And then at times when you have some, sore throat, cough, some infection, this is a stress on your body. And under the conditions of stress, your sugar will slightly go up. And you should not worry about that. Sometimes I get a call from my patients, my sugar is 300. Then we ask them, do you have any fever, some viral fever? During those 4-5 days, it will bounce up. And then you start taking your tablet maybe twice a day. But once you are relieved of the fever, again it will go down.
ठीक.
Because under stress, sugar will go up. So you should understand that you are a potential diabetic.
Okay.
Like you see, there are some ladies, and during pregnancy they have diabetes. After
And it
pregnancy,
goes-
no
goes.
diabetes. They are called as potential diabetics.
ठीक.
Understand? So always tell your doctor that you were a diabetic and now your diabetes is under control because of the surgery.
ठीक.
Like for example, if you have to undergo some surgery like taking out gallbladder or appendix or hernia,
So you will be
that would
requiring-
again be a stress on your body.
So you will be
At that
requiring
time,
a
yes,
diabetic.
maybe you might be requiring tablets or insulin during surgery or for 1 or 2 days, and again it will go down.